Good afternoon, ladies and gentlemen. Welcome to the legislative update. We're so glad that you're here today. My name is John Hampton, and I'm honored and privileged to be your state representative and welcome you to this great conversation. At the Capitol this year, I continue to be fascinated by aging issues. People always say, wow, you're so interested in aging issues and supportive of seniors, and it's really great. Why is that? And I say, well, I'm getting older. People talk about aging, that it's something that doesn't happen to them, that it's some sort of special interest, but it is the great equalizer, and Lord willing, we'll all live to be 200 years old, and in those 200 years, be healthy, happy, and comfortable, and productive. And the good news is that people are living longer, but I always say the bad news is I don't think necessarily that we're ready for an explosion of seniors in the next 10, 15, 20 years. We're not ready for their health care. We're not ready for keeping them in their homes. We're not ready for keeping them in the workplace. I've met more and more people in their 60s lately who say, I don't want to retire. I want to keep working. I can't find work. Job programs are geared for people who are over 50. So there's that concern. People are concerned about Medicare and Medicaid. People are concerned about Alzheimer's disease and other related illnesses. People are concerned about prescription drugs. People are concerned about what they'll do for tax relief, what they'll do after their spouse is gone, getting veterans benefits, getting support. So I probably was the only freshman that asked to be on the aging committee this year. As my friends from the legislature know, it's not necessarily the most cool place to end up when they ask for appropriations or something a little more glamorous, but I was thrilled and asked for a seat on the aging committee. And it was a roller coaster the freshman year, and so much happened, as you know, related to Sandy Hook and other issues. But the good news is that there was a laser-like focus on aging, and that's the way it should be for all of us. And for my parents, as they're getting older, and nobody prepared me for caring for older parents, and there was a lot going on. And I had a lot of support at the Capitol in getting acclimated to the issues. Some of my colleagues who are here today, at the far end, John Erlingheuser, who represents the AARP. Of course, everybody knows the AARP, an incredible organization, national organization. And John, I've known for a long time, and is full of knowledge and experience that he generously shares, and was at my back all the time, talking to me about different issues, especially related to the energy auction, which we'll talk about today. But he's a great resource, and AARP is a great organization, which, by the way, there's a lot of literature in the back from these great groups that are here today. So when you grab a donut, grab some literature and check it out. There's also this incredible organization called the Connecticut Commission on Aging, which is a legislative commission staffed by Deborah Migneault, who, with Julia Evans-Starr, does a great job of serving as an arm of the legislature to help us push through legislation that will support elderly, especially aging in place issues, which was a key initiative. I'm going to let Deb talk about it a little more. And their organization is incredible. One of their board members is here today, commission members, Bill Eddy. So Bill, thank you so much for coming. He was a great resource too, and he lives right here in Simsbury. Bette Marafino is president of the Connecticut Alliance for Retired Americans, which is Connecticut's premier senior advocacy organization. It's a national organization that lobbies hard for preserving Social Security, preserving Medicare. It works closely with retired union employees. She's a dynamic new president of the organization, and they're a strong presence in the state, and they were a strong presence at the Capitol this past session. And I couldn't have done my job without Bette and the Connecticut ARA. Also at the table are the town officials, Deputy First Selectman Heavner and Shannon Knall. Shannon is liaison to the Aging and Disability Commission. Ed LaMontagne is here, who's chairman, and Ron Zappilli and his wife Arlene are here. Vic Bible of the Aging and Disability Commission. Anybody else here from Aging and Disability? a great committee that meets on a monthly basis to talk about aging and disability issues and how we can make people's lives better. Shannon is the liaison. Lisa, as Deputy First Selectman, has done an incredible amount of work creating partnerships with the high school and seniors and pushing forward senior tax relief and other initiatives that benefit our local citizens, Simsbury senior citizens. I wanted to acknowledge, I don't think they're in the room, Kathy Marshall, head of the Senior Center, Mickey, of course, Beck, head of Social Services. Who else did I want to recognize? Everybody in the room for coming, and sign up for my email alerts and back if you want to keep up to date on things that are happening at the Capitol. And now I wanted to introduce John Erlingheuser from the AARP, who will talk about his organization, what it does, and kind of his experience this past legislative year.
Thank you, John. And first, I want to thank Representative Hampton for putting this together. And this is something we always offer to legislators as they come into the legislature that would like to always do to keep their constituents informed of what's happening. And John is one of the few representatives that follows up on that. And it's very much appreciated. I will say you're all very lucky and that you sent John to the legislature. In fact, I've known him. The tie is, even though I'm from the Naugatuck Valley, I live in Ansonia, John was the legislative assistant back in the day for my state representative, and so when I was pestering my state representative, I always got John, and I know he's very responsible and responsive and attuned to the issues that we're here to talk about today. Was back then when he was a staffer, and certainly is now. And I think it's putting it lightly to say he did have a baptism by fire on aging issues, not just the long-term care and health care issues and aging in place issues that I'm going to let others talk about, but on just basic pocketbook and consumer-related issues that seniors care about. And you know when you do a press conference at the beginning of the year taking a very controversial stance against powerful interests, and there are only two legislators that show up to be at your back, and one of them is a freshman. It really shows the spine he has and the fact that he's willing to take on powerful interest, and Representative Hampton did. And that'll kind of be my segue right into talking a little bit about telephone service and deregulation of landline telephones and what we call digital or voice over internet protocol phones. And they're really two separate issues, but right now people don't always know the distinction. You go into your kitchen, I'm sure many of your homes, you go in your kitchen, you have a phone on the wall. And you think that's a landline, but it's not always a landline. A landline that we consider to be a traditional landline is a phone that gives you your phone service over an old-fashioned copper wire, in the old days. In Connecticut, it's mostly, in fact, it's provided throughout the whole state by AT&T, with the exception of 20,000 people in Greenwich, Connecticut, who get it from Verizon. But the phone company, for all intents and purposes, in Connecticut is AT&T. And they provide that service. Now, that's not to be confused with those of you who get your phone from your cable company. I don't know who the provider is up here in Simsbury, but where I live, it's Comcast, so I guess it's Comcast here as well. And I buy my phone service from Comcast, but that is not a traditional phone. Even though the phone service may be coming through to you on that same phone that it might have 35 years ago, that's hung on the wall in your kitchen. That's a digital product. That's a voice-over internet product. The phone company itself, AT&T, also offers a similar product, Uverse. And many of you may get cable and television bundled with internet from either AT&T or from the cable company. But those are not traditional phones. And about a quarter of the people in Connecticut still get phone service from a traditional phone, and they tend to generally be seniors and people in lower incomes and people in the cities where the other products aren't available. But there's a big distinction between the two products. And that distinction is that the state requires on the old-fashioned copper wire landline that there are service quality standards applied to it. So in other words, if the phone goes down, it has to go up in a certain amount of time. And the phone company is required to provide that service. They have to. They have to be the provider of a traditional old-fashioned service. And what was going on in the state of Connecticut, and frankly in most places, is the big phone companies are trying to do away with that requirement that they must provide that service. And and that they must follow quality standards like maintain the lines, take care of the copper wiring so that the signal comes from where it is being generated to where you want it to go, and that you will be guaranteed that service and at an affordable price. And we've been fighting that for several years. And AT&T, primarily in Connecticut, but along with Verizon, pushed very hard in this legislation to be able to eliminate those services. But I don't know how many of you here get your phone service from your cable company or for AT&T Digital, but where I live, we had 2 major storms that affected the lower Naugatuck Valley pretty severely, and I was without electricity for 5 days at a time in each storm. Now, other places were much more severe, and I think it was probably pretty severe up here as well. And I considered 5 days to be pretty lucky, but guess what? Since I buy my service from the cable company, I was without phone service, internet, and television for as long as I was without electricity. If you got your phone the old-fashioned way on that line that had to be maintained throughout, before, during, and after the storm, you had phone service. Because there are quality standards in play. There's a requirement to provide that service, maintain the lines. There are no requirements on the other digital services. They don't have to give you that service. They don't have to offer it in the area that you live. They don't have to guarantee a price because it's not regulated. And in fact, they don't want to give you the phone service unless you buy a bundle of options. You cannot go to your cable company, you cannot go to AT&T and say, I only want a digital phone, I don't want internet, I don't want cable. A lot of seniors don't need 250 cable television channels and don't need the highest speed internet that exists. But they do need a phone. And they need a phone for health, safety, protection, you name it. Security systems run on traditional landlines. Most medical products that are offered, like regulation of pacemakers, you need a traditional landline. And, we feel that that obligation needs to be there. Now, we're not trying to hold back time. We need to get to a point where we are in a new technology. But our contention is that it has to go along with the service standards and the regulation that exist with the old-fashioned services. And that leads to second, and I will say we were very, very successful with the help of Representative Hampton and many others of defeating that legislation again. And I have to tell you, AT&T, the phone companies have went all around the state literally promoting this legislation as a win-win for seniors, and people knew better. I mean, just people knew better. I can tell you, I went on radio show after radio show and people would call up and say, I bundled my services. The only thing I didn't bundle was my phone, because you don't have to buy the phone. They don't care if you take it or not because it doesn't cost them anything. But when the storms came, I lost my cable, I lost my internet, but I had my phone. And so that really sealed the deal. So we were very successful with John's help in defeating that, but what it leads to is the other legislation. It's a bill to preemptively take away the state's ability to regulate the new technologies. Currently, the FCC, the federal regulators, haven't caught up with the new technology, so a lot of it isn't regulated. And we're moving into a direction where states are going to be able to regulate various aspects of it. Right now, we took away the right to regulate cable companies. I mean, the regulations that we had in place, we took away about 7 years ago. And then when it comes to the phone services, there are none and we can't regulate it. But what the cable companies, along with AT&T, who offers a digital product, which is the one they want you to get, they don't want to provide the one that they have to maintain and keep and guarantee, and the price is regulated. What they want to be able to do is not ever have to regulate have that be regulated at all. So what they're doing is going from state to get states to preemptively give up the right to ever do it. And they'll argue, well, what's the big deal? You can't do it now. And my response, and people like John's response back is, well, what's the big deal? Why do we need to give something up before we even explore what our options might be in the future in doing it? So we were successful. It's a much more difficult thing to defeat. But luckily we have people like Representative Hampton and others who kind of see it for what it is. Why should the state take away our right to regulate services before we even know if we're going to be able to do that? And the fact of the matter is, we're looking for a communication system that says, it doesn't matter what the technology is that provides you a phone, but you should have the right to know that are guaranteed in getting one, that the price is going to be fair, the quality is going to be the same as the old-fashioned network, and they have an obligation to maintain and keep up that network. And that's all we're asking for. We're not looking to hold back time and have them maintain an old copper wire network. We're just looking for the same guarantees on the newer, better network. And we think that's very, very critical. And so far, we've been successful, and we'll take that up again. So that's one big issue. The second issue is, and by the way, these and other issues, as Representative Hampton pointed out, are in the back. But we also worked on tables, but we worked on another issue. John referred to the energy auction. Currently, about half the state's electric customers get their electricity on what's called standard offer from CLMP and UI, 800,000 households. The other 800,000 choose to go into the competitive supply market and buy the supply portion of their bill from a third party. It's people like Dominion, North American Power, Public Power. There are any number of companies. Gulf Oil now has a company, Con Edison, and then potentially save a small amount of money on that portion of your bill. You know, I contend whether it's even worth it because there are so many issues involved with actually going through and picking a supplier, making sure you know the terms of your contract, you know whether you're in a fixed rate or a variable rate, you know how many months it's for, you know whether or not there's a cancellation fee to the contract. There are any number of things that could be problematic when you choose to do this. And by the way, if you choose the cheapest supplier on the market today, on average, if you use like 75 kilowatt hours a month, or 750 kilowatt hours a month, which probably most of you don't use, you'd save about $3 to $5 a month for the aggravation. That's if you get the best contract and it's fixed. For going through all of this aggravation, that's about the best you do. Well, so the point of all that is saying that the other 800,000 of us, people like me who choose not to go into that market, there was a proposal to take all of them and auction them off 100,000 at a time to these private suppliers. So taking your value as a customer and auctioning you to them, and the kicker is that the state was going to use that money for deficit reduction. Not even use it to lower your electric rates, which we pay about the highest in the continental U.S. So part of the reason for this was they wanted revenue, but the other part of the reason was AARP, other consumer organizations have worked so hard in bringing the cost of buying your electricity on standard offer down so that if these suppliers are really doing a good job, they're going to beat a good price, not an inflated price. For about 5 years, these suppliers were giving you a really good deal. You'd save $15, $20, $30 a month. The reason was because the state artificially inflated the cost of the electricity to quote-unquote create a market. And that went on for about 7 years. We reformed that, and we tried to make these people clean and honest. Now, the fact is they're having a harder time competing, but that's because, you know, it's not really a good idea in the first place. There's no volume, there's no scale. So the state wanted to sell your value as a customer to them, take the money, and then do away with the market forever. But here's the kicker. We know how much you're saving because you compare against the rate CLMP or UI gives. If that rate goes away and we give complete control of the market to these private energy suppliers whose sole purpose is to make money, how do we know what the deal is? We wouldn't know. We wouldn't know. We wouldn't have a benchmark to compete against. So we're not saying do away with the market necessarily. What we're saying is keep it clean, keep it honest, and the way you do that is having a regulated benchmark, which UI's rate and CLMP's rate is. Because, by the way, they don't make a penny off of that. Everything else in the bill they make money off of, like transmission. They don't make money off of that other rate. That's regulated by the state, and the companies come in and try to beat it. So we fought very, very hard for this and to oppose this. And Representative Hampton, once again, as a freshman, was willing to go against his own party leadership and the governor in opposing this, because frankly this was a proposal of the governor, mostly because he wanted to fill the budget hole. You know, it was kind of like dogs were cats and cats were dogs. Republicans in the legislature who really liked the market were opposing it, mostly because it was the governor's proposal, regardless of what good and bad points of it were. But then others really we're looking at it and saying, oh, well, do we need the money, but what are the long-term consequences of getting this money? And what are we going to do to people's electric rates? And we demonstrated very clearly that they would go up, and people like John looked at that and took place. So there is a little one-pager, by the way, back there that explains this and talks about it. You could take that, and if you're interested in getting updates about electric issues or phone issues, you can fill in a little card there. Either leave it with me or drop it in the mail, postage-free, and we'll keep you up to date. I think I will leave it at that, and as I said, there is a one-pager on all the things that AARP worked on, including some of the issues that I know Deb and others will talk about today. So, John, I'll turn it back over to you.
Thanks, John. Appreciate it very much. It's so important that we have strong partners at the town level, and luckily we have with us today for Selectman Lisa Heavner and Selectman Shannon Knall. Again, Lisa has been Selectman now for 4 years, and she is a strong advocate for seniors and expanding senior programs, and she took the lead on creating partnerships with the high school and the whole school system, and she's been vocal in other programs as well, senior tax relief, and I wanted to let Lisa, as a representative of the town, talk a little bit about what programs are available for seniors in town. I know you work closely with Kathy and Nikki, and they do a great job, but just thought you might want to say a few things.
Thanks, John. Thanks to everyone on the panel for coming here today, and welcome to everyone. I see so many familiar faces out here. One of the things I started, actually, John, you were helping getting me started, was the Senior VIP Pass program. And what that does, this is actually what it is. It's a Senior VIP Pass. How many people in the audience have one of these? Okay. There are 550 have been issued. And what they enable you to do as a senior is attend any sporting event, any musical, any theater production at the high school for free. There's normally a fee anywhere from $5 to $12. Has anyone taken advantage of any of these programs? I see Mona. If you haven't been to the theater productions at the high school or some of the musical, it is well worth it. It is the best buy you can get in town, and it's actually quite a value to seniors too. And we started this because when I first took office and I was talking with John and some of the school officials, we realized that there were people at the high school and the school system who had never been to the senior center, who had never been to the Plains, and there were people from the town who had never been to the high school. And we thought that we could do better and make it a better partnership. So the schools are, of course, their primary goal and mission is to educate our children, but they're also part of our community. And they wanted to open up to the greater community, so we started this program. One of the things we have coming up, and I see Mona is here, and Ed, I recognize Ed Lamontagne, he was in this right from the beginning as chairman of the Aging and Disability Commission. And we brought together him, school administrators, superintendent of schools, the senior center director, and social services department, and we still get together once a year to make sure that we are designing programs. Some of the things we do, and I'll try and speak up, I'm getting a hint there, is we try and bring the kids into the senior center and seniors into the schools, and they come for productions and shows, but they also volunteer in the schools as well. And one of the things we actually have coming up tomorrow, I'll put this here, is our first senior citizen night at the high school. We do several a year. And we are doing an early bird dinner at 4 o'clock. And the director of athletics will be there to talk about the different programming at the high school that you can take advantage of with your senior pass, your VIP pass. And the dinner is free. And then after that, we're going to a girls' volleyball game, which begins at 5. And we bring in students. We have the girls' twirlers coming in. And the students help serve the dinner and then join the seniors for dinner. So it's a great opportunity for a lot of our students who have grandparents who live far away in other areas of the country. And for our seniors who have their grandchildren who live in other areas of the country to interact. And that's just some of the things we've done. We recently had the principal of the high school was in our senior citizen fashion show. So I guess the point I'm making is we worked very hard to bring the schools into the community and to bring the community into the schools. And that's a benefit we can extend to our seniors at no cost. And so it's a great way to give service without adding to the tax bill. So that's one of the projects I've been working on. It's now in its 4th year, and I'm so grateful to have so many partners, even in the audience, and so many attendees. And Kathy wanted me to let you know that there are still a few spaces, so if you want to come, you just sign up at the Senior Center. And it's there are opportunities to volunteer there, and it's a fun night.
Lisa, thank you. Do you want to remind people about the senior tax relief program? Because I know when we adjusted it a few years ago, a lot of people weren't aware that it actually existed and they might be able to qualify for it. It's elderly and veterans, correct?
Yes, so we do offer a number of programs. You can find them on our website, or Kathy Marshall at the Senior Center will help you access eligibility requirements. It is income-based, and you can go on and it's tiered. So depending on your income, you will get more or less savings on your taxes. And John, I think, was one of the co-chairs of that commission, so thank you for that and your initiative on that. But what we try to do is we hear right now in town, almost 7 out of every 10 tax dollars you pay go to education. And we're very proud of the education we have in Simsbury, but we also felt that because so many of your tax dollars do go to education for those who have had children out of the schools for 10, 20 years, we wanted to make sure that you were still able to stay in our community and be a vibrant part of our community. And so we made an effort to make it a little more affordable. And what that means when you do that, when seniors pay less, it means that those who are not seniors pay a little more. But we felt that that was fair because those who are paying a little more are often those with children in the schools and who are getting the direct benefit. So that was an exciting program. You can call our tax department, the first Selectman's office.
And I just wanted to add to what Lisa's talking about, that I think a lot of seniors and a lot of our residents who might need help from time to time get concerned about coming to the social services director or the senior director. But all the information that is shared with them is confidential, whether you need long-term support or short-term assistance. They maintain strict confidentiality when you come to see them. And during these difficult times, it's not just older folks that are looking for help. I've seen an astronomical jump in people who are the young people losing their jobs or getting sick who need extra help. And I know social services and the senior center have been inundated, but all of us, it's our job to be as supportive as possible. You know, Shannon Knall is a big advocate for seniors, and I know she's been involved as liaison to the Aging and Disability Commission. Shannon, I was wondering if you could talk a little bit about what's going on there. Also, maybe touch on the senior center, the proposed senior center. I know a lot of people are talking about that and have questions. So thank you, Shannon, for being here.
Thank you, John. Thank you all for being here as well. We have, as you know, I see a lot of familiar faces out here. And as you are well aware, we have an extremely vibrant senior community, an active, involved senior community. So the job of one of the jobs of the Aging and Disability Commission is to ensure that great resource remains intact and that we are bringing all the pieces of our community together. And currently there is a proposal under consideration, or 3 proposals under consideration for the location of a potential senior center. And how many of you have been involved in discussions on that? Good. That's good. We have had several public hearings in front of the Board of Selectmen. I know that there have been meetings here as well to introduce the 3 potential locations. One at Stratton Brook, one here in Eno, and one in the Performing Arts Center. So that remains something that you should be invested in and continuing to read up on, because the senior center should be a place where our seniors can be together and find friendship and find opportunity to remain active in our community. We want that to be what happens going forward. I also want to talk briefly about another initiative that we just started, and I'd like to recognize Ed LaMontagne as well for the work on the Senior Job Bank, which will be coming to Simsbury. It was part of Simsbury in 2008, I believe, and now it has returned. And what that means is that if you are over 50 and interested in being involved in looking for some extra work, there are members of the community who will go online and enter the kind of work that they're looking for, say a tutor or someone to drive them, or house cleaning, whatever the case may be, accountant. And you as a senior would be paired with someone who is seeking that job. So if that is something that you are interested in and want to be a part of, that information is available on the town website. So that's it. I thank you all for everything that you do and your active role in our community.
Thank you, Shannon. I see that our first selectman has just walked in. I'd like to welcome her and ask her to say a few words. And thank you for joining us, Mayor Glassman, and thanks for all your work here locally for senior citizens. And as I was saying earlier, it's great to have strong town partners who care and work hard on these issues. So thank you for joining us.
Thank you, John. Thanks for hosting this wonderful forum. It's good to see everyone, and welcome. We are really proud of what we do here in Simsbury, and forums like this where you can hear about programs that are happening, and forums like this where you can tell us what we need to do to improve or make life better are really important. There's a lot of exciting things that you heard, I'm sure, this afternoon, and a couple of the town's initiatives, certainly thanks to Shannon for her efforts in the Senior Job Bank. We think that's a really exciting opportunity for folks to share their skills with others, and also for those of us who need work and want to employ our local seniors and use their talents. It's a really exciting program. As we head into the winter, I just want to remind you what we were all doing a couple of years ago when we were 13 days without power, who's counting, in our community. And special thanks to John, who used to chair our public safety committee, and of course Lisa Heavner, who's now the Deputy First Selectman. Wanted to remind you that we have a wonderful neighbor-to-neighbor program that Lisa helped coordinate through our social service department. We are looking for partners. What that means, our neighbor-to-neighbor means that we take care of each other. And we identify folks in our community, our neighbors, our friends who need help, and we connect them with wonderful volunteers, nurses, doctors, neighbors, to look out for each other. And we think that's a great program. We need to educate all of ourselves about how we need to take care of ourselves during an emergency. We're very fortunate in this town to have wonderful emergency responders, but there is a time that we can't get to you, and your neighbors can get to you, and other folks. So special thanks to Lisa for heading that up. We're trying to spread the word. So if you are willing to share looking out for others with us, please let us know. And if you're aware or have a need to have someone check up on you, or you know someone who needs that, please let us know so we can plug them into this wonderful program. I'm sure no one's interested in hearing an update on the Senior Center, so I'll move on. We're anxious to hear your input. We in Simsbury plan not just for tomorrow or for next year, we actually plan for the future of our community, and we're planning for 10, 20 years out. So one of the needs demographically is our enrollment declines, our elderly population grows, and that changes what the services and what the community needs to offer. We've been blessed to have wonderful donation with Memorial Hall that has served us in a variety of different ways over the years. But we need now to plan for the next steps and making sure that we address our population as we age. We want to do that in whatever way is best for our community. We really taking a lot of time in analyzing the best location, the best alternatives, and we're looking forward to some input as the Board of Selectmen moves forward to make some recommendations. So I'll sit back and listen, and thank you again for coordinating this wonderful gathering.
Thank you, Mayor. Appreciate it. Connecticut Commission on Aging is an incredible resource, as I mentioned earlier, for being a great partner to legislators, regardless of their party or affiliation. And I've worked with Bette, Julia Starr, and the godmother of the Connecticut Commission. You're too young to be a godmother, but Migneault of the Connecticut Commission on Aging. It's been so terrific and really leading the way on so many different issues, and so supportive of the Aging Committee. So I wanted to welcome you and thank you for all you did this past year. I know your work has just begun, and we're gearing up for another exciting session, but I thought you could talk about what you do, what your organization does, and what happened this past year. So thanks for being here.
Thank you. Thank you for having us all. This is really great. We'd love to come out to the communities and talk about public policy. I've become a complete policy wonk. I actually have a little short story. My husband's a huge Red Sox fan, and last week he was downstairs. I tend to ignore him. He's downstairs watching the Red Sox. He's screaming and yelling at the TV, and I'm rolling my eyes. My 11-year-old son comes upstairs, and I roll my eyes, and I'm like, Dad is a little bit crazy about the Red Sox. He says, Mom, it's just how you feel when a really important bill passes the legislature. He's right. he's totally right. I love this stuff, and I get really excited about it. So thank you, Representative Hampton. Representative Hampton, as John said, has been so supportive of so many aging-related bills, and really supportive, quite honestly, of the Commission on Aging. We've been through some tough times, budget-wise, budget battles, and he's been right with us, supporting us, and really, I know, working very hard behind the scenes with leadership to make sure that we stayed in the budget, because there was a period of time that we weren't sure we were going to. We are a very small office at the state capitol. We have our offices right on the 5th floor of the capitol in what we call retrofitted offices in the attic. And there's 2 of us right now, and actually we are about to expand to 4. We're doubling in size. There's going to be 4 of us, so really watch out, because we're going to be really busy. So there's 2 of us, and do all types of different work. We do a lot of partnership building, coalition building on many, many projects. We are a nonpartisan office, as Representative Hampton has said. We lead with data and best practices, both state and national best practices, always trying to really be very objective in our work. And we work with both Democrats and Republicans and anyone in between, and trying to help guide public policy around aging-related issues. And of course, my partners around the table, ARA and AARP, we couldn't do all this. We have to work together, and we do. There's many, many nights, late nights at the state capitol where John and I are out talking at midnight. So I'm going to go over a few things that happened last session, and kind of the exciting things that are yet to come. And one of the things that happened actually 2 sessions ago was there was an Aging in Place task force that got put together. We were charged, the Commission on Aging, with serving as administrative staff of that task force. This, again, happens quite often that we are charged with serving as administrative staff, again, because we are a nonpartisan office, and we're looked at as a very objective source, so we serve in that role to help kind of guide the task force through their process. So the Aging in Place task force was meeting in full force about this time last year, and on January 1st came out with a series of recommendations. Then from that, there was a bill that got put forward with several of those recommendations in that bill. And we worked through the Aging Committee to pass that bill out of the Aging Committee, and eventually it did pass at the 11th hour. The Aging in Place bill had several components. Probably one of the more substantial components of it was that what was recognized by the task force is that we are, as a state, policy-wise, and actually at the federal government policy-wise, trying to help people stay in their homes and communities longer. We would, everybody, I don't think anybody in this room, if I asked you to raise your hand, how would you love to go move to a nursing home? As much as McLean is a beautiful place. Nobody's gonna say, yes, I would love to do that. People want to stay home. And so our state policy, something we've been working very hard at the Commission on Aging, has really been, that movement is moving forward. But what we're finding is that some of our laws, our statutes, are not in line with that. They're kind of out of date. And one of the pieces of that, we looked at the mandated reporting statute. And mandated reporters are mostly professionals out in the community that if they see instances of abuse or neglect, they have to report it. Similar to a social worker in a school or a teacher has to report to DCF if they see abuse. So there was many professionals that are outlined in the mandated reporting statute that they have to report, but what's interesting was those professionals were not in the community. They were mostly nursing facility based, and we're saying we're missing a whole piece of this. And so one of the pieces of the Aging in Place the Aging in Place bill updated that statute to try to include members of the professions that are working out in the community. For instance, a certified nurse's aide that works in a nursing facility is required to report abuse if they see it. However, if that same certified nurse's aide is working for a home health agency and is out in the community, under the law, they did not have to report. And so now we've sort of aligned the statute to reflect the trend in our state. And so that's kind of, just one piece of it. It actually had several pieces. And just a brief story about that. Representative Hampton, was following this bill and urging its passage throughout the whole process. And it literally passed at 11:53 on the last night of session. And John and Claudio were there, and we're texting back and forth and hoping it's going to go. And talking to him throughout the day and many others. And it did finally go, but man, it was a nail-biter. So a couple other things that went past this last session. One that we are charged at the Commission on Aging with moving forward with is a Livable Communities Initiative. I love hearing some of the things you guys are doing in Simsbury because it really ties right in with this Livable Communities Initiative. Livable Communities is really, again, about allowing people to age in place, but really making sure communities are ready to have so many people aging in place. Our state is kind of moving forward like, yes, people are going to be staying home, we're going to be offering all these services, and the municipalities are, oh my gosh, how are we going to do this? And how do we, it's more than just services, it's really about making sure people stay engaged in the community. That VIP pass is great, it's a way of staying engaged in the community without a cost, neighbor to neighbor, and helping, when things are difficult, and are there people around that can help. In some communities, Simsbury is really quite lucky because they are thinking about these things, but some communities are not. And so the Livable Communities Initiative put in place an initiative within the General Assembly at the Commission on Aging to really help inform municipalities, regionally and individual municipalities, about best practices and trends. Really, we hope to become the hub of all that information so that we can be a service to our 169 municipalities in preparing. And so, one piece of that is putting together a website and making sure that we're grabbing all of these great best practices and innovative ideas and sharing them throughout the state so that, there's pockets of wonderful that happen throughout the state, but not everybody knows about them. They can be replicated throughout town, so we hope to continue that. We will report back to the General Assembly, the Aging Committee, every year on our progress of that. And what we sort of expect might happen is that as this rolls out, as we're talking to communities, it very likely may be that we might find some of our statutes are not keeping pace with what communities need. And so that it's also a forum to bring that information back to our legislature and say, hey, just like the Aging in Place Task Force went through that process, again, here are some gaps and here are some possible solutions, and then taking legislative action on those. So that's really exciting, and we hope to be back out here in Simsbury talking about livable communities and hearing about your great work. It's really exciting. So a couple other little things, again, talking about, trying to get you a feel of our work at the Commission on Aging, again, trying to keep state policy and looking at our statutes and what, our programs and what is kind of lagging behind, and we need to up to date with community-based living, helping people age in place. One of them is we have this wonderful program in the state called the Long-Term Care Ombudsman Program. The Long-Term Care Ombudsman has, I want to say, about 15 staff in all the regions, and they work in nursing facilities to make sure that the quality of care in the nursing facilities is in people's rights. It's really about individual rights in those nursing facilities are to their fullest. And so whenever there's an issue, the long-term care ombudsman is there to help negotiate that issue with the nursing facility. Nothing like that exists for the community. And we know more and more people are moving in the community, and there might be these issues out in the community. So part of the budget and part it was actually part of the budget was to pilot a community-based long-term care ombudsman. And so it's very small. It's only going to be in the Hartford area to kind of see how it works, what resources the ombudsman needs to be able to do this effectively, and hopefully over the long term, over several years, we can get that statewide. There were several components of the budget that supported home and community-based services, allowing people to remain in their homes as they age and receive services and supports in the community. Right now in our state, we're a little off balance. We spend more in nursing facilities than we do at home, and there's a lot of support. Everybody here at the table, and really the whole legislature and the executive branch, it's a whole movement to really change this system so that we're providing more community-based supports. It's like trying to move the Titanic, so it takes a bit of time, but it's happening. And so there were several pieces of funding in the budget that supported that. And I just wanted to mention one more thing, I think, and that is something I personally am right in the middle of right now, and I know that Representative Hampton was a big proponent of this. There is right now Alzheimer's task force that's meeting, Alzheimer's and related dementia. They're working on lots of work going on, lots and lots of meetings with really wonderful and passionate people that really know these issues and are experts in it, really. And they're looking at workforce needs, they're looking at quality of care, early intervention, and early diagnosis, and several things. And they're just right now sort of coming up with their recommendations, and there will be a report due on January 1st. Again, I'm very involved in that because, once again, the Commission on Aging was asked to provide administrative staff support to that task force. So, and we do so very, very gratefully. That is, I think I could go on, but obviously.
Thank you so much.
Excited about these things, sure.
Since we're talking about aging in place, I haven't heard any mention of the Connecticut Home Care Program, which is huge on aging in place. And I noticed a little note here that the Commission on Aging and 5 other legislative divisions received adequate funding in the budget this year. That is, the home care program for seniors has not received commissions and reimbursement rates in 9 years.
Yes.
13 different agencies have closed because with the new billing system and directly accountable to DSS, there's not enough funding and not enough money in that to hire the extra people that we need to do our own budget, which used to be our own billing, which used to be done through the access agencies. So how can we help people age in place if we are not being given, apparently committees are being given adequate funding?
I should qualify, our adequate funding is so little funding, you wouldn't believe it. There's only 2 of us.
And that's pretty much the adequate funding for our program. They have been adequate 9 years ago when they set those rates.
Yeah.
It's not adequate.
You are, yeah, we know. The home care program for the elders, I didn't get into specifics about those community-based services. The home care program for the elders is the largest and wonderful program. It's really a diversion program. It is what is keeping people out of nursing homes in the state.
It is a model for the rest of the country.
It really is.
Fabulous program.
And the provider rates has been and continues to be such a challenge. And really, I mean, we have been trying. What we try to say is, we know you invest in these diversion programs, you invest in these community-based supports, you're actually going to save money down the road because people won't end up in nursing facilities at $72,000 or more a year. They will actually be able to receive care at a much lower rate. So we have to invest in those systems, and that has been really quite a challenge, especially given the budget situation. But it's such a challenge in trying to get that message across and realizing we really need to invest in this community-based system. So thank you for bringing that up.
Thank you.
I just want to add, because, you know, I don't want to prolong this, but the fact of the matter is, we spent the last several years fighting to restore cuts that were made to the services part of the Alzheimer's, the home care program, state-funded portion of the program, because access was limited. There were co-pays, there were things that were added to the program that would have restricted access by individuals that could have gotten to the program. And the Commission and AARP and the Alliance and others have been very successful in both getting those co-pays reduced and funding restored so that actually people can get access to the programs. And so there are two separate issues, and the provider issue is another issue, but I want to be very clear. We have been fighting yearly, and sometimes multiple times in the same year, to ensure that access to that program is available to people. So I understand it's
you don't have to provide
two separate issues, but
then it doesn't matter how many.
it's the same. Right, it's two separate issues, but the same, you know, that come to us the same problem. But I want to make it clear, because I don't want people to get the impression that we haven't had fights over preserving it.
I'm sure you have, John,
because we have.
Before, and I know that the cost sharing has gone up, and then you guys managed to bring it down.
So,
That's hugely helpful. I'm certainly not accusing anybody.
No, I just wanted I wanted everybody in the room to understand, you know, the background on those fights.
Sitting quietly here at the end is the, last but not least, is Bette Marafino, who I've known for many years. She's the president of the Alliance for Retired Americans, which is a national organization, grassroots organization. Connecticut has a strong chapter. I had the pleasure of working with them for a while. And there's a couple board members here, local residents, Bill and Marilyn Tiska, who are want to come out and strong advocates for elderly and aging issues. But Bette heads up the Connecticut chapter. I know there's a lot going on with you, and I know you were an omnipresence at the Capitol and had a great senior day. You created Senior Day at the Capitol a couple of years ago, where you rallied the Capitol. So welcome, and tell us about your organization and your priorities.
Thank you, John. And by the way, Marilyn Tiska is one of our 9 vice presidents, and her other half, Bill, is on our legislative committee, and they're very, very active people in the Alliance. Thank you, John. And actually, when John said we've known each other a long time, John went to high school with a couple of my kids, so it's been a few years.
So it's Mrs. Marafino, not
me. He still calls me that, and I guess it's Bette. Anyway, thank you for inviting us here today, and I just want to talk a little bit about the Alliance and then take the discussion on 2 different tracks that we're working on. One is the state track and the other is the national track, and there are a few little things going on nationally that seniors may be a bit interested in, like preserving Social Security and Medicare. But first, let me talk about the Connecticut Alliance. There are 34 states that are part of the Alliance, which is part of the AFL-CIO, and we get some very minimal funding from them. And so we have been in existence for about 10 years, and there are about 50,000 members in Connecticut who are members of the Alliance for Retired Americans. In fact, some of you may be members and may not realize it. But if you are a retired teacher, whether you were in CEA or AFT, they are part of the Alliance. If you are a retired state employee, you are part of the Alliance, or if you were in AFSCME or SEIU or any number of trade unions, then you are part of the Alliance. We also have some community groups. One of our new groups is a small group in Unionville, which is CC=A, which stands for a community that is dealing with access, and these are mostly people who are in wheelchairs. When we had Senior Day at the Capitol, some of them came in their wheelchairs and their walkers, and we were happy to have them. And so let me just briefly read from our new trifold, which is up on the back table. Please help yourself. And there's also a little place if you want to be a member, because individuals can be members for a whopping sum of $10 a year, the dues. But anyway, I will read what our goals are, and you will see that they are in concert with a number of things that were just said. But to protect Social Security and Medicare, to ensure these safety net programs are available for future generations. So we are not, as one prominent former state legislator said, not from our state, but another state, called us greedy geezers. We aren't, because we also want to preserve these things for our kids and for our grandkids. Another goal is to increase funding for social service needs for seniors, and most of those were talked about already by John and by Deb, including the respite care and lowering prescription drugs and lowering utility bills. Ensure that retirement and health benefits promised to workers are guaranteed, and also to expand access to affordable senior housing. And I won't go into that because I think Deb covered that very carefully, but we were working with the Commission on Aging and other groups last year, because livable communities and aging in place, that is a big umbrella issue for us. And so any of the issues that go into that area, those are issues that we will work on, and we hope to work on them again in the coming year. We are in the process of putting together a survey of our members, which we have done for the past couple of years, and the preliminary results, what we're seeing this year as the #1 issue, which was also the #1 issue last year, was universal health care for all. By far, that outpaced all of the other issues. But coming in a close, well, not a close, but coming in a second and third were to get funding help for prescription eyeglasses and for hearing, and those have been bills that haven't gone very far lately, but we're continuing to push for those. Other issues are to lower property taxes, which is a daunting task, but those are issues, and we're trying to address the needs of our members, and we're currently putting together our legislative agenda, and we will be working with other groups in coordination, as we've done in the past, to go to hearings and to get our members to support those bills. And those are all on the state level, but I'd like to just direct our attention for a little bit to the national level. And I know you've heard a lot about entitlement programs, which means Social Security, Medicare, Medicaid, and we are working with our parent group in Washington on legislation, national legislation, that we hope will preserve and strengthen both Medicare, Medicaid, and Social Security. And if you saw, I think it was Meet the Press last Sunday, Senator Dick Durbin from Illinois, who is the #2 in the Senate, Democrat, who is going to be on this new committee that before December 13th is going to look at some of the costs of some of this, and to come to some kind of bargain or grand bargain, which kind of frightens me when I hear the term grand bargain. But Dick Durbin said on Sunday, he said, I want to look at cuts to Medicare and Social Security, which gave me a chill. But there are some people in the government, in Congress, who have put together some bills, and I'm going to just give you some numbers and names, and then I'll be available after if you'd like to write them down, because we're urging people to get online, to research these bills, and to make calls to our congressional delegation. And I must say, we're lucky in Connecticut, because our congressional delegation has been fighting to preserve Medicare, Medicaid, and Social Security. But sometimes some of them need a little nudge to say, get on board and co-sponsor a bill and also to encourage them and say, we appreciate what you're doing, keep on going, and maybe convince others in Congress. And so there are a couple of bills that deal with both Social Security and Medicare. And the one that is dealing with Medicare has been put forward by Congressman John Conyers from Michigan, who I believe has broken the record of serving the longest in the United States Congress. It's something like 50 years. It's been a long time. And it's House Bill 676. And it's called Expanded and Improved Medicare for All Act. And he has 51 co-sponsors. And I double-checked again this morning, because every few days I get online and I start checking to see what's going on. And no one from Connecticut, no one in the Connecticut congressional delegation has signed on yet. So there is a website you can get on to follow all these bills, and it's Thomas, THOMAS.gov. And if you just get online, and then you can put down either the bill number or the name of the person, the congressperson who is sponsoring it, and then it will show you who the co-sponsors are, and it will give you a synopsis of the bill. So that's House Bill 676. And then there are two bills dealing with Social Security, one in the Senate and one in the House. And the Senate bill is Senate Bill 567, and that is a bill that has been put in by Senator Tom Harkin, who is a Democrat from Iowa, and it's called the Strengthening Social Security Act of 2013. And he has quite a few sponsors on that, but again, nobody yet from Connecticut, though some of us have talked to Senator Blumenthal and Senator Murphy, and they both said that they support it, but they have not signed on yet. So I think they need a nudge to say, could you sign on and co-sponsor it? And that will strengthen it. In fact, his bill would propose giving, on average, about $800 more a year to the average senior Social Security recipient. So it's good to check on that bill. And then in the House, there is a similar bill, and it's Bill 3118, and it's called Strengthening Social Security Act of 2013. And it is sponsored by Representative Linda Sanchez from California. And she currently has 37 co-sponsors, and one is Rosa DeLauro from our own state down in the New Haven area. And that is to strengthen Social Security, to put more teeth into it, and to convince people that it needs to be around. Because, you know, it is not in imminent danger of going broke. And in these provisions, they're talking about raising the cap, because I think right now, Social Security, if you're earning up to, I think, $110,600, maybe someone can correct me, but it's in that neighborhood. That's what you pay Social Security on. And they're talking about raising the cap sum so that, for example, somebody making $250,000 might have to put more into Social Security, thus strengthening Social Security. So those are two very important issues. I think we need to pay particular attention to this new committee, bipartisan committee that's been formed in Congress, to see what they're going to come up with as we're starting to approach December 13th, and make contact with our legislators. Every time we talk to a person in Congress, they always say, keep telling us. We want to hear what people are saying. And so we're right now signing petitions and saying, preserve these things, support these particular bills. So there's a lot going on, and we have to keep fighting the good fight.
Bette, thank you. You have a website, right?
Yes.
The national organization. Is it AARP.org?
Yes.
Alliance for Retired Americans. And I know AARP has a website. Both these organizations you can join. I know we can. Can we join you? We can support you. Yes. But,
We have 21, as Bill was mentioning, we have 21 board members throughout the state, but they're appointed by legislative leadership.
Bill's our board member.
Bill is
Our very own. And he's a great asset for Simsbury. But Betty, I know that you started bringing seniors together at Senior Day at the Capitol. Can you tell us about that initiative?
Yeah, thank you, John, for reminding me. For the past 2 years, we've had Senior Day at the Capitol, and we had it in the spring, shortly before, just before the legislature goes out of session. And John has been very instrumental both years, getting things set for us. Everything from making sure the microphones are there and the chairs are all set up to making sure that legislators show up for the event. And what we do during those days, we have a free breakfast in the morning at the Legislative Office Building, and we talk to the people who come, and we've had over 100 people come from all over the state both times. Talk about what issues are current in the state legislature that we are supporting, that we want people to go and visit their legislators and talk to them about the bills. And then we all trekked across the LOB through the tunnel to the north wing portico of the state capitol, and we had a gathering there. We were thinking of a rally, but John told us you can't have a rally inside the building.
We didn't want any arrests.
No, we did not want arrests. But so it was called a gathering. We had chairs for people, and the first year it was called Seniors Rock, and we had a rocking chair, and some people took turns sitting in the rocking chair and rocking. And our national president, Barbara Easterling, came in from Washington both years in a row. In fact, the first year she said, "This is the first state that's had this kind of a gathering, so have it next year and I will be there." And she had flown in from Brussels the night before and flew to Connecticut, and she was with us. And Julie Evans Starr from the Commission on Aging was there, and Edith Prague was there, the new Department on Aging, the new commissioner. And we had Sharon Pope, a lawyer, who talked about elder law. And John spoke, and the speaker spoke, and
Every day at the Capitol, there seems to be a day. There's Chiropractor Day, there's Farmer Day, there's, everybody seems to have a day. Finally, we're scratching our heads saying every day is Senior Day, but they should have a day at the Capitol. And these folks all came together and it's so important that you keep in touch with your federal, state, and local officials to advocate. And that was just one day, but it did inspire a lot of people to get more involved on a regular basis. You mentioned, Betty, the Department of Aging, and does anyone want to talk about that? It's a new department. Yeah, that'd be great. It was created this year. We have a Department of Education, we have a Department of Environmental Protection. We did not have a Department of Aging, and now we do.
So the Department on Aging is an executive branch department. Basically, I mentioned the long-term care ombudsman program, the long-term care ombudsman program, and about 14 other staff members that are were part of the state unit on aging. And they were originally part of the Department of Social Services, so it's about 28 staff, part of the Department of Social Services, and kind of called them a new name, Department on Aging, and gave them a commissioner and an administrative assistant. The commissioner, as probably everyone knows, is Edith Prague, the former state senator. Edith Prague, now the commissioner of the Department on Aging. And so they're really the same entity, just now with a commissioner. They have maybe an elevated status a little bit. Same staff, and they're still even actually housed at DSS. So they operate programs and services like the Alzheimer's Respite Program, the nutrition program. I'm sure many of you know about the either Meals on Wheels or congregate meal sites. Funding comes from the federal government through the Department on Aging and out to our communities. And so they operate that program and several other programs, small programs, but I would say Alzheimer's Respite and nutrition are the biggest ones, I would say. And so, and then of course the long-term care ombudsman program, which is
And our new commissioner is only 87 years young.
She's our new old commissioner. She was the commissioner before.
She was commissioner before she was senator, and now she's commissioner again. And I think she's going to be 88.
I mentioned earlier seniors and employment, and I don't want to put her on the spot, but there's a constituent, a resident, who's here, who's working on something called a senior job bank, and I wondered if she wanted to just say a few words about what it is. She has been doing some presentations around town. I like her because she's from Terriffill. Her name is, she's a former Board of Education chairman and member, resident, active resident, Mary Margaret Turgeon.
You're funny.
Thank you.
Thank you. Thank you. No, seriously, I appreciate the opportunity. I'm here today in regard to the Senior Job Bank, in addition to listening to all the information that you're updating us on. The Senior Job Bank was a program that operated for many years, approximately 35, and it's a way of putting together people over the age of 50 who are looking for employment and matching them up with perhaps people over the age of 50 who are seeking someone to work for them. We have met with Mary Glassman and members of the town Commission on Aging, and now you will find on the website of the Commission and on the Senior Center website information regarding the Senior Job Bank. So our goal is simply to put together people who are looking for employment and for some specific task, perhaps it may be something related to a home or construction, or it may be, a personal issue, short-term employment. The job bank will provide you with the names of 3 individuals, and you can then make a choice from that. The job bank will be operating out of West Hartford. That is where the office is, but we're working in collaboration with the Simsbury Senior Center and working also with the library. So we will be trying to put together local people who want jobs with local people who are seeking employment. The basic thing that you should also know is that we will do the evaluation to assure that the person is a responsible party. We will be doing a background check on them, and they only charge to someone to participate in the program is that $20 for a background check. But we're just starting up again, and we look forward to the opportunity of serving people in the community of Simsbury, both people looking for jobs and people who are seeking someone to do some perhaps time-limited kinds of functions with them.
Where are you located?
You can go online and you will see Senior Job Bank. That is the best way to reach somebody. The office is out of the town of West Hartford in the West Hartford Town Hall. But we're operating on a very, very small budget, so it is not manned substantially. So if you go online to the Senior Job Bank, that is the best way. Or you can call, particularly between the hours of 10 and 12, 860-521-3210, and there is someone there during those hours. But Dennis Carruthers, who formerly was principal at the high school, and I will be interviewing people here in town for anyone who is seeking a job. So we'll be working either here or at the town library to do some interviewing.
That's great, Mary Margaret. And,
Thank you, John.
Thank you very much. I'm going to set up a meeting with Mary Margaret and I'll be the Labor Commissioner to talk about making the Department of Labor is great, and it's great for people who are young professionals or looking for non-professional type jobs. But I'm finding more and more when folks, seniors over 50, anybody over 50 who goes to the Department of Labor for support for a job, they're not geared toward anybody over 50. There's not enough support for that. So hopefully together we can change that, because I meet so many seniors who, they're 60s, 70s, they don't want to retire, they want to keep working and contributing in some way to to our society. So thanks for your hard work.
What I wanted to do, I know I talked much about the work that John Hampton has done, and it kind of worked out well because our volunteer selection committee comes up with a list of legislators that we work very closely on to recognize for work that they've done. And as I said, Representative Hampton had been deep in the trenches on all of the issues that all of these organizations have cared about, whether it's affordable utility rates, whether it's long-term care, home and community-based services, quality of care. And so it's one of the first times we've ever had, since we've had a state office in 13 years, a freshman that has been out in front on those issues. So what they decided to do was put John down as one of our legislative achievers for 2013. And so, John, actually the timing of this meeting was good because I think he got a letter like days before we were actually planning on doing this meeting for a couple of months, right, as one organizations. We decided to present it to John here today in front of the people in Simsbury that he represents so that they are aware of the work that he does. The 2013 Legislative Achievement Award to Representative John Hampton for strengthening community services that give individuals the choice to age with dignity in their homes and expanding supports for family caregivers. And as I say, he was also there on every one of the issues that we're talking about today. And so, John, on behalf of 600,000 members of AARP in Connecticut, I'd like to present you with this.
I can't be late anywhere now.
And I have to say, the first meeting I had with Representative Hampton today, I didn't put on my calendar this first year as a representative. He forgave me for it because I didn't put it on my calendar. And he was looking all over for me, and it was my fault. So anybody will forgive me after that faux pas. I appreciate it.
Well, plus you brought donuts today. Thank you so much. I share this with my colleagues and with all of you. Thank you for coming today. We'll be around for questions. Help yourself to donuts and paperwork. And again, thank you for your help.
Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.